Why solving chronic pain feels impossible? It feels impossible because you're doing great solutions that work by themselves, but maybe not specific to your problem. I'm Derreck, the founder of OBF, or Optimum Beyond Functional. I've helped people with 20 years of low back pain who've done a lot of chiropractic, and we resolved that in 16 sessions. I've helped people who couldn't sit crisscross, and now they can sit crisscross. I've also gone on a journey myself for my own ankle of 3.5 years of no weight training. But during that time, I did a lot of corrective, mobility, and fascia work. And now I'm very back to normal at a very good baseline. All that to say is there's a reason why your pain feels impossible. It's because we're probably not doing the right solution for you. And what I mean by that is, think of it as like trying to fix something very quickly, like duct tape, right? Our duct tape is probably strength training mostly. Now, nothing wrong with that. I love using duct tape and I love strength training, and it can work, when the duct tape can help keep it stable for a short period of time, but it's not a permanent solution, right? Because the duct tape will no longer work anymore, or we need more duct tape, or it's simply, again, it just doesn't work anymore. And so we need a different solution. The same can be said for strength training. The strength training can make you feel stronger, can maybe temporarily take away the pain, but if the pain keeps increasing and not getting better, there's a good chance that strength training is not going to solve your issue, not because it's a bad solution, but because your issue, the question you're trying to answer is not, do I have lack of strength? It is, do I have something restricting me? Or is this not connecting? Or is something XYZ causing the pain? Not, is my lack of strength in general causing me pain? Because even when we strength train, it's not very specific. It's more like, okay, I'll just generally get stronger. And that works well to become stronger. That doesn't mean pain-free. If you have a faulty foundation and you just make it stronger, it will make that foundation even more weak, even more painful, because you're just amplifying all the areas that have not stable sections or just are aggravated more by loading more external weight on it. And that same thing can be said for other solutions like chiropractic, physical therapy, massage therapy. Again, great solutions by themselves, but if you tried it and it didn't work, there's a good chance it's not specific for your problem. If we did duct tape and we tried different shapes and different fitments and positions to help make this thing we're trying to fix more stable, and it just falls apart, then it's probably not gonna fix it, right? But maybe we need a bit of pieces of those things. Maybe we don't need a full-on tube. Maybe we need like a part of that tube, like maybe like a cover of it, to then put it on this thing to make it stand up straight or just be stable. The same thing with our solutions. Maybe you don't need the full PT route or the full chiropractic route. Maybe we need an element of those. Like massage therapy, the element you would use is soft tissue work, right? Not the relaxation, but the elbow and the knuckles and the hands to address that soft tissue specifically. Maybe you need the kinesiology expertise along with the soft tissue work to then address that issue properly along with the movement. Maybe the PT isn't necessarily the rehab, but like the movement part combined with everything. And that could be, a long session, could be a short one. It really just depends on the movement dysfunction and or fascia restriction. And that's okay, that's normal. We like to think it's not normal, but it is if you've done something really repetitive. And I always tell my clients or my people that it's okay to have a repetitive job or task, because it's just part of your day-to-day life and job. Your body will get used to that. The problem occurs when we can't get out of it, right? That's when the real problems occur. If you can get in and out of it, you're not gonna really have any issues. But when we can't, that's when we really start to see the issues. So strength training will only solve strength-related things. If your pain is not caused by strength training, as much as you love it and as much as research there is behind how good it is in general, it won't solve your problem. That's when you really need to start applying these solutions together for your specific problem. Maybe, if you sit a lot, maybe it's addressing your restriction in a sitting pattern, or maybe you don't know how to heel strike well. Maybe you can't stand up properly. Like, there's a lot of things that go on along with restrictions that happen along the body or the kinetic chain. And not to make it sound so complex, you really want to understand, what is your baseline? Can you internally, externally rotate the shoulder well? Can you do it well on the hips? And not just doing the movement, can you do this basic movement pattern in multiple planes of movement, or basically in different angles of movement, normal? If you can't, that's okay if you can't. A lot of people like to freak out. You don't need to freak out. It's awareness. And secondly, it's understanding what you have and don't have. And when you don't have it, we want to understand, why don't you have it? How can we get there? Once you do that, you can then go in the right direction, because arguably the hardest part with solving chronic pain is going in the right direction. If you can go in the right direction, we'll keep progressing. The opposite is, you don't go in the right direction, you keep trying good solutions, but nothing improves. Not your baseline, not your pain, certainly not your effort, right? Because you're probably trying really hard at this point. And so it's about understanding something very basic, which is, what question are we solving for? And we do that very well at my studio at OBF. In our consults, we really understand what baselines you have in your movement, posture, fascia, all combined together. Also looking at your pain and your movement history or injury history. By having all of that, we can then understand what direction we really need to go in for you. And if we do that, then your pain can finally start subsiding or going down in the right way, not because of the solution, but because of how we use the solution specific to you. And if that sounds like you, please reach out, and I'd love to connect with you over the phone or email. Otherwise, I hope you continue to keep getting to a good baseline, and I look forward to seeing you in the next video.